Welcome to Malden Rotary. It's Wednesday, May 5th, 2021, and tonight we have Dan Hoffenberg, who is Vice President of Cataldo Ambulance and a former Malden Rotary member. And tonight he's going to discuss what role Cataldo has played over the last year with the COVID-19. Dan?
Yeah, hi. It's good to be back here. So I was a former Malden Rotary member, past president, probably about 8 years ago at this point, eight or 9 years ago, I think. And it's good to be back. So Cataldo Ambulance, just for those that don't know Cataldo, we're a company that's 44 years old. We're an ambulance service, private ambulance service that was started in 1977 by Bob and Diana Cataldo out of Everett originally. We're one of the larger private 911 or private ambulance services in Massachusetts, and the largest 911 provider in Massachusetts. We do 20 different municipalities in the greater Boston and North Shore area for the most part. And throughout our history, our employee count has never been more than about 700 field staff. So I say that thinking I'll tell you a little bit about where we're at now and what's happened to us in the past year through COVID. So through COVID, just like every other small business, we kind of took a hit originally. When COVID struck in March of 2020, our business went down immediately by about 20%, which is surprising to most people. Most people think that our business might have exploded a little bit with the number of sick people, the number of people getting sick from COVID, but actually the opposite happened. We went down 25% because of a few reasons. Number one, elective surgeries were canceled by hospitals. So all those knee replacements and hip replacements and ankle fractures and things like that that were canceled by hospitals make up a good percentage. About 50% of our business is transports from local hospitals to skilled nursing facilities or to patients' homes for rehab appointments. So when they stopped elective surgeries, we lost quite a bit of call volume from those types of calls. The other thing we lost was 911 volume. So 911 volume went down dramatically over the first 3 or 4 months of COVID. Part of that was attributed to people just not calling 911 for minor issues. So if they hurt a finger, they stayed at home. If they hurt a toe, they stayed at home. Other aspects of that were family members weren't allowed to join some of the seniors at the hospital. So if we had a 911 call for an elderly person and their son or daughter was at home with them when we responded to the call, they weren't allowed to go to the hospital with their parent to support them or to advocate for them when they got to the hospital. So a lot of the elderly folks, or a lot of the sons or daughters of the elderly, were turning down the transport to the hospitals because they weren't allowed to go along for the ride and they weren't allowed to be there in the emergency room with them when they got called. So all that kind of contributed to us declining in business by about 25%. And that happened industry-wide, nationally. Really, we saw very similar trends. So we had furloughs just like a lot of other small businesses. We furloughed a good amount of our wheelchair van drivers. We furloughed a good amount of our some of our admin staff and marketing and some of the areas of our business that we could do without for a little while. And then somewhere around June of 2020, we started getting phone calls to see if we could help out with COVID testing. Those calls were coming from some of our municipalities, some of the municipal partners that we've worked with for a long time, saying, hey, do you guys have some staff that can help us out with COVID testing in our communities? So we didn't really plan to get into this business, but we certainly had some EMTs that weren't working quite as often on ambulances. So we said, sure, we can help out with this. So we started training some of our EMTs to do COVID tests, which is a very simple procedure for them. It was an anterior nasal swab, which is just a Q-tip in the nose. You've probably all gotten it before. Just a really simple procedure. And we started sending them out to various locations and doing that. So we were doing that for a little while through June and July for the most part, on a very small scale, just kind of supplementing our business and finding jobs for our EMTs to do while the ambulance volume was down, so we didn't have to lay them off. We didn't lay off any field staff ever. And then first week of August, I was actually on vacation, playing the horses up at Saratoga with my family, and I got a call from a company called CIC Health. CIC Health was spawned. CIC originally is called Cambridge Innovation Center. So they're a technology company. They're actually a real estate company that rented out space to startup technology companies for them to sort of all work together in the same environment, share resources, and start their business. So similar to us, they were a company that saw a dramatic decline in their business through the pandemic. There was just not a need for people weren't going into the office. There wasn't a need to lease office space in Cambridge and Boston. So they started a division of their company called CIC Health. CIC Health was designed to respond to the pandemic and do COVID testing initially. So they started a whole company based around COVID testing. And we were their first customer, and we actually helped them get going. So they signed us on to manage their software, sort of be the guinea pig for their new software development, be the guinea pig for their COVID testing sites in Cambridge and in Boston. So we started running their sites for them, starting with their own employees, so we could manage their own employees, so their employees could get back into the office in early August of 2020. And then from there, they were started by a guy named Atul Gawande. So for those familiar with healthcare, Atul Gawande is a nationally known physician from Brigham and Women's Hospital, who basically speaks at every conference that you've ever been involved in on the healthcare industry. He is on President Biden's committee, COVID task force committee, just a very well-known guy. So he was one of the founders of CIC Health, and we didn't really know this when we got involved with them in the first place. Anyway, that company, with their connections to the state and their connections to the healthcare industry in Massachusetts, kind of took off. So when they took off, we kind of took off along with them, to the point where we were getting phone calls every single day from customers of theirs. So their role was having a relationship with the Broad Institute. So they supplied us with the COVID tests, they supplied us with the technology, and we supplied the personnel. So at that point, as they started to take off, we were getting calls from a lot of private schools in and around Boston that we had no idea even existed. So private schools in every single city and town throughout Boston started calling us and saying, hey, we were referred to you by CIC Health, saying you might be able to help us out with COVID testing on site to make sure our students and faculty are safe. So we signed, let's fast forward quickly, started off with 10, went to 20, and quickly fast forward to about 70 different contracts with private schools throughout Massachusetts. So that was our primary business line, was supporting CIC Health as their staffing partner to all their contracts that they were signing to support COVID testing for private schools in Massachusetts. Our service area had typically been Boston and the North Shore. We expanded to the South Shore. We expanded west as far as Worcester and Springfield to support their efforts in COVID testing. So we ultimately created an entirely different vertical, an entirely different business line that was just COVID testing at this point. On top of that, we got our own relationship with the Broad Institute, who is the primary lab that's involved in all the testing in Massachusetts for PCR testing, anterior nasal swabs. So we signed our own contract with them. We were able to purchase tests directly from them. So we started our own private business outside of what we were doing with CIC Health. That private business was marketed to a lot of the municipalities we already worked with to do public testing sites in those cities. So we signed contracts with a lot of municipalities just to run regular sites for them as well. We set a rate for what we were charging per test, created a whole separate business line on testing around that. Then we signed ultimately a contract with the Commonwealth of Massachusetts to do stop the spread sites. So they're all of their public sites that they were running, they needed a provider for those. So we signed contracts with the Commonwealth to do sites in Everett and in Randolph, Randolph, of all the places where I actually grew up. So, so those are kind of our three different business lines in COVID testing. Naturally, this kind of progressed into what was our next move in this space. So COVID testing went on. We were seeing numbers in December into the thousands. You guys remember, so anytime you lined up at a site, there was a 2 to 3 hour wait at these sites. We were doing 1,000 people in a 6-hour period. In Everett, we were doing 700 people in Randolph. That's gradually started to decline in January after the holidays. The next move was COVID testing. So what were we going to do for vaccinations? So what were we going to do for vaccinations? So on Christmas Eve, we had our first call with CIC Health about what our next move was with vaccinations. And we said, you know, we can support you with vaccination efforts. We supported you through testing. We'll support you with vaccination efforts. Our goal originally was to have the Mass Ambulance Association all sort of combine efforts and have enough EMTs and paramedics available to do vaccinations. We were kind of way off on what we anticipated their ability would be to help out. We have to run ambulance services at the same time. So a lot of those companies said, we're not really interested, we can't really do it. But we still told CIC Health, basically, we're all in. We're in for this for the long haul with you. We found out on just before New Year's Eve, or on New Year's Eve, that they got a contract for Fenway Park. So the tool go on, they called up 2 people to get this started. He called John Henry from the Red Sox, and he called Robert Kraft from the Patriots and said, we want to use your facilities for mass vaccination sites. So that's kind of how CIC Health got involved in the contract. They called us and said, we have these 2 facilities, can you guys support us? We said we can at Fenway. We said we probably can't at Gillette right away. So Gillette started with Fallon Ambulance, Transformative Healthcare, was brought on to work with them for Gillette. We were brought on to work with them for Fenway Park, and Mass General Brigham was brought on as the overall oversight for the entire program. Interestingly, a 4th company was brought on after we started getting going and realized we needed some help with logistics. That company was DMSE, which is Dave McGillivray Sports. Dave McGillivray Sports, if you know his name, is responsible for the Boston Marathon. So they are a road race company. Dave McGillivray has overseen logistics for the Boston Marathon for about 47 years. And their industry as well was in shambles. He had absolutely nowhere to go with his industry, with all the road races canceled nationwide, obviously the marathon being one of them. So CIC Health brought him in to handle logistics for mass vaccination sites, which basically saved his industry as well. So it's kind of a cool story how all these companies that were taking a pretty hard hit because of COVID came together and sort of built their companies back up, took advantage of the pandemic, so to speak, and built their companies back up to find a new way of doing business because of COVID. So those are the companies that were involved. So at this point, we needed staffing. So we were a company of 700 people. We had about 800 people at this point because of the testing. We hired about 100 to do testing. In order to run Fenway Park, we needed somewhere in the neighborhood of 100 or so people a day, 7 days a week for 8 to 12-hour days, depending on the day, which meant we needed to recruit really quickly. So we got on the news. We started a campaign. We called Stick It to COVID. We sort of had a campaign strategy around Stick It to COVID, which was all these people that have been on the front lines of healthcare for the last year were extremely tired and wanted a way to fight back. And doing vaccinations was kind of their way to fight back. So we started a whole campaign around that, put it on Facebook. Just based off the Facebook campaign, we had about 500 applications in about the first 4 days. from healthcare providers all over Massachusetts, nurses, pharmacists, doctors, veterinarians, whoever you could think of that could give a shot, or the state allowed to give a shot to patients. The news picked it up, Channel 7, Channel 4, Channel 25, everybody kind of picked it up, and we started doing interviews on the news. After we did the interviews, in about a weekend, we had over 4,000 applications to join the vaccination efforts in probably about a 2-week span, total of a 2-week span. So we connected with schools. We used nursing students at Endicott. We used nursing students at Mass College, or pharmacy students at Mass College of Pharmacy, pharmacy students at Northeastern. So we sort of connected to all these groups. So then we needed to figure out a way to get all these people hired. We rented space at the Commonwealth Hotel in Boston. We rented their conference rooms, which were going to waste because nobody was booking any events at any of these conference rooms. So they signed us on. They gave us a good deal just to be part of the effort. And we planted ourselves in the conference room at Commonwealth Hotel for about 2 months, and literally just had HR people there processing individuals one after the other, where they processed, of the 4,000 applications we processed about 1,200 of them. We got 1,200 people in the door working for us in about 4 weeks to start up Fenway Park. So we went from a company of 700 people to a company of almost 2,000 people in about a month, 4 weeks to 6 weeks. And that's where we are today still. So we started at Fenway. We knew Fenway was kind of a training ground for what was to come. We started off with 200 vaccinations there a day. We moved to 5, and we quickly moved up to about 1,200 vaccines a day. We knew that the baseball season was going to start. We knew that that meant that we probably weren't going to stay in Fenway Park, or it was going to be a bit of a different schedule for us. And that's when the state went over to Hines. So they went to Hines with the intention of doing 7,000 vaccines a day. They put a closing plan in place for Fenway. And we were set to move over to Hines. Now, we were good to go to Hines, and then the vaccine shortage really kicked in. So when they made the choice to go to Hines, ultimately we didn't end up having the vaccine available to even run Hines. So the state thought they were going to get about 7,000 doses a day for Hines. We ended up with about 1,500 doses a day. When we first started Hines, it was actually smaller than what we were doing at Fenway because of the shortage of vaccines. So we did that for about 2 weeks, and then they made a pitch to FEMA to kind of fill in the gaps in what we were missing. So they put an application into FEMA, sort of with the understanding that this was going to hit Boston area. Obviously, it was accessible to lower income communities, which was interesting, but it's accessible to lower income communities. So FEMA came through and gave them an additional 6,000 vaccines a day to support the Hines effort. So at that point, Hines got split between Navy personnel. They brought in about 215 Navy personnel, and we had about 150 other Cataldo personnel every single day on site. And that's sort of where we stand right now. So we did about 7,000 vaccinations a day for the first month, and now we're scaling down. So we're kind of in the scale down process now. We're down to about 6,300 vaccinations a day that we have access to. We're booking out of those 6,300 about 6,000 appointments, and we're starting to struggle a little bit with the number of people that we're seeing every single day. So now we're at a point where it's flipped kind of, and there's more vaccine than there is people that need the vaccine. So next step for us was doing pop-up vaccination clinics. So what pop-up vaccination clinics are is going out into the hard-hit communities, the underserved communities, setting up clinics right in those areas. So we sign contracts in Chelsea, Revere, Fall River, New Bedford, and Boston. So in Boston, we have regular clinics in Chelsea, regular in Revere, Fall River, and New Bedford. In Boston, we're in about 5 different sites a day that are in underserved populations, so underserved communities, Roxbury, Jamaica Plain, Dorchester, Hyde Park. We did a big clinic today in Roxbury. So every single day we're in these communities, and these are literally 100 to anywhere from 100 to 300 person clinics inside churches, inside community centers, schools for, multicultural schools for international and immigrant populations. We're going to places basically who weren't going to come to us. So a lot of these immigrant populations weren't interested in coming to the Hines. They weren't interested in going to Gillette or the Reggie Lewis Center even. They were interested in us coming to them. So we're kind of in cell mode at this point, where we're going out to find the people that haven't been vaccinated, trying to figure out why they haven't been vaccinated, and work with community groups to make sure they're comfortable being vaccinated. So that's where it's kind of flipped a little bit now, more than a little bit now, is the supply outweighs the demand for the vaccine. So we're in an effort now to try to get as many people vaccinated as we possibly can. That's kind of where we stand. Am I still on here? Because I think
You're still with us.
all right, getting all sorts of pop-ups. So that's kind of where we stand right now. The mass vaccination sites are due to close by the end of June. We're going to keep the pop-up sites going for as long as it takes. If we do a clinic of 25 people, then we do a clinic of 25 people, but it's 25 more people that are vaccinated. So every day is different. We stay extremely flexible. All of our staff are per diem. They know this will probably come to an end sooner than later. We're waiting on right now guidance about the 12 to 15-year-old population, who we think is going to come across any day now with the emergency use authorization for vaccine for 12 to 15-year-olds. We're doing 16 and up right now with Pfizer. So that'll be our next step. And then it's kind of wait and see and stay flexible and go from there. So the state at this point has shifted their focus away from mass vaccination and back towards local public health departments to take care of, underserved populations or populations of folks that just aren't getting the vaccine, or it isn't accessible for them. So